With the client laying face up, apply the Vela spray and spread it over and rub it well into the skin. Use back and forth motions along the length of the upper leg to ensure heating and mobilization of the deep tissue layers. This maneuver is performed from the knee to the groin of the inner, central, and external thigh. Turn the applicator as necessary to maintain good contact. When the tissue is loose, the skin must be held to improve the movement of the applicator. If the skin of the inner thigh is very loose, the vacuum level should be set to 1 or 2. Never use level 3 when treating loose skin. Radiofrequency levels, however, may be at level 3, as our target here is to refirm the tissue. When working on the knees, use circular movements, as this is a zone with significant retention. Perform circular massage over the entire previously treated zone, emphasizing areas with higher levels of fat accumulation. Use back and forth motions in a zigzag pattern over the entire zone. Repeat this maneuver wherever fat accumulation is detected. You may complete 3 ascending passages in the groin zone to drain lymph nodes. Perform back and forth sliding maneuvers across the ribs and iliac crest. In the abdominal zone, the sensitivity threshold is usually lower, and therefore the parameters must be adjusted. Perform ascending and descending movements in the area between the ribs. Perform circular movements around the umbilical zone. Perform ascending and descending movements to the umbilical zone. Apply ascending movements from the pubic area to the umbilical area. Always hold the loose skin of the pubic zone. Emptying of the descendant transversal and ascending colon. Emptying of the descendant transversal and ascending colon. These last steps are specifically indicated for people with constipation. Use a stacking technique in the entire umbilical zone. Do not apply more than 5 consecutive stackings in the same zone, as the heat may cause discomfort. Stage 1. With the client laying face down, apply ascending and descending movements lengthwise along the back of the leg, never going over the area behind the knee joint. Stage 2. Apply circular movements over the previously treated area on the back of the leg, particularly if there is fat accumulation or fluid retention. Perform lengthwise back and forth movements from the back of the knee to the buttocks. Do not forget to work the sides of the knees. Heating of the buttocks can be more difficult because poor circulation is common in this area. Massage the area from the back of the knee to the buttocks, placing more emphasis on areas with greater fat accumulation. In the buttocks area, power levels can be adjusted as this is a less sensitive area. Stage 3. Apply back and forth maneuvers in a zigzag pattern from the back of the knee to the buttocks, giving special attention to areas with greater fat accumulation. Apply upward movements to the buttocks to model it. Stage 1. Apply downward lengthwise movements from the dorsal paravertebral zone to the lumbar paravertebral zone. Apply lengthwise movements from the iliac crest to the lumbosacral area. Stage 2. Apply circular movements to the hips and in zones of fat accumulation common in the lumbar area. Stage 3. Apply lengthwise and zigzag directional movements from the dorsal area to the axillary area. Apply ascending and descending movements in the dorsal area. Apply circular movements in zones of fat accumulation. Apply back and forth movements to the arm on outer and inner parts. Contour applicator. This applicator is designed to access zones too small for the large applicator. It can also be used for facial work. In facial work, use the following parameters and always begin with minimal level settings, that is infrared at 1, radio frequency at 1, and vacuum therapy at 1. Increase to 2 maximum depending on the skin reaction and the sensitivity of the client, and always use the stacking technique for facial treatments. Begin working in an ascending direction from the neck to the chin. Continue with ascending movements on the face, cheeks, contour of the eyes, and temple, ending with the forehead. Treating the temple and the forehead, you may want to reduce the vacuum setting to 0. Always maintain a safe distance from the eyes.